Welcome to Dental Scholars, where we share useful information related to dentistry and oral health. The interproximal areas of teeth are the surfaces between two teeth. They're usually hidden surfaces to the bristles of a brush, thus leading to deposition of plaque and food debris, causing different gum disease and cavity, which are called as gingival or periodontal disease and dental caries, respectively. People tend to suffer from different dental and gingival problems, despite brushing their teeth twice a day. The probable causes may be improper brushing technique or not flossing their teeth, among others. In this video, we will provide introductory information related to dental floss, its technique, and its importance. Dental floss. Dental floss is one of the mechanical plaque control aids for removing plaque and biofilm from the interproximal tooth surfaces, preventing its accumulation on the teeth and adjacent gingival tissues. The American Dental Association, ADA, recommends using dental floss once per day to remove microbial plaque biofilm effectively. Various dental floss is available, and the type of floss to be used depends on personal preference. They may be of nylon filaments or plastic nanofilaments, waxed or unwaxed, thick or thin, and so on. Dental floss has multiple functions. It removes plaque, biofilm, and food debris from the interproximal embrasure and under the portion of the fixed partial denture. It is also responsible for stimulating and massaging the interdental papillae. The dental floss acts as a vehicle for applying polishing agents or therapeutic agents to the interproximal and subgingival area. Along with these functions, it helps in locating subgingival calculus and deposits, overhanging margins of the restoration, and proximal carious lesions as well. Flossing technique. Generally, there are two methods of holding dental floss. There is the spool method and the circle or loop method. Spool method. In the spool method, a floss of 12 to 18 inches is taken and held securely in the fingers or tied to a loop. Then the floss is stretched tightly between the thumb and forefinger and is passed through contact areas in a firm back and forth motion. Once the floss is apicalled to the contact area, it is wrapped around the proximal surface. This curves the floss at the base of the tooth and form a C shape, and is now slipped gently under the marginal gingiva. In this way, floss is moved up to the contact area and moved gently to the sulcus again, in up and down stroke 2 or 3 times. The same procedure is repeated through the whole detention, including the distal surface on the last tooth in each quadrant. When the working portion of the floss becomes dirty, a fresh part of the floss is taken. Circle or loop method. In the circle or loop method, a 12 to 18 inches long dental floss is taken, and a loop circle is made. Both ends are tied securely with 3 knots. All the fingers, except the thumb, are placed within the loop. Now the floss is held tightly by both hands, with about 1 to 2 inches of floss between the fingers of both hands. Precautions while using dental floss. There are a few precautions that we need to take while using dental floss. We should not make quick snapping of the floss once it reaches the contact area, because it may create a proximal groove in the gingiva and may injure the indental gingiva. Floss holder. Different types of floss holders, reusable floss tools, and disposable floss tools are available, which can simplify the manipulation of dental floss. It is helpful for patients lacking manual dexterity. Powered flossing devices are also available, which may be easier for some patients, but it has limited use, as it is not so effective in removing plaque biofilm compared to handheld floss. Conclusion. Since toothbrushing alone is not sufficient to control gingival and periodontal disease, it is recommended to use dental floss once a day to remove microbial plaque biofilm and food debris, preventing gingivitis, bad breath, and various proximal lesions, and for maintaining optimum oral health status and a healthy smile.